Hello, this is Dr. Joe Garri from Mosa Plastic Surgery. Welcome to episode number 5 of the Surgeon's Corner podcast, a series dedicated to patient education on topics related to aesthetic plastic surgery. Our topic for today is the Gummy Smile, otherwise known in medical jargon as a smile with excessive gingival show or gingival display. It has been said that a smile, just like the eyes, can be a window to the soul. Beautiful smiles are as varied as those who display them, but the mechanism of any smile is distinct and has to do with the relationship between three anatomical components of the face, those being the lips, the teeth, and the gums, otherwise known as the gingiva. Each of these components has its own set of morphological characteristics or certain parameters as to how it should look individually and how each, in turn, should relate to the other two components. The smile itself is caused by the function of the mimetic muscles. These are the muscles of facial expression, which are located in the face and the neck. There are some characteristics that are thought to be the hallmarks of a pleasing smile. The smile is usually symmetrical, with lips that are full, well-defined, supported by teeth, and have a proportionality when it comes to size of 1/3 for the upper lip to 2/3 for the lower lip. The teeth should be well aligned and positioned, displaying proper size, shape, and contour. Furthermore, the upper dental midline between the two front teeth, called the central incisors, should ideally line up with the center of the upper lip and the midline of the nose and the face. The gum tissue, otherwise known as the gingiva, should be of a healthy pink hue with a contour that scallops around the teeth at the junction where the crown of the teeth meet the roots, an anatomical demarcation known as the dental-gingival junction. At full smile, the teeth should rise up to this level or slightly higher, with a gingival show ideally of no more than 1 to 2 millimeters. A smile pattern, which can be very concerning to patients, is often referred to as the gummy smile. This term denotes a condition in which at full smile, more than the usual 1 to 2 millimeters of gingiva is displayed. The gummy smile can sometimes be of significant distress to patients, as it makes some feel self-conscious. Others become so distraught that they even refuse to smile altogether. A sad state of affairs indeed. Alterations of any of the three anatomical components that make up the smile can result in a gummy smile pattern, as for example, when the gum tissue is inflamed due to periodontal disease or certain medications that are known to have this side effect. In these cases of a gummy smile due to gingival hyperplasia or enlarged gums, a procedure called a marginal gingivectomy can greatly improve the situation. In this procedure, the overgrown margin of the gum tissue around the crown of the teeth is surgically removed, thereby decreasing the amount of gum tissue visible at full smile. However, in most cases of a gummy smile, neither the gums nor the teeth are the issue. Thus, for the rest of this particular discussion, we're going to limit our consideration to some of the other common causes of the gummy smile, those being the short upper lip, vertical maxillary excess, and the hyperdynamic upper lip. We will also discuss how to differentiate between these conditions, as their respective treatment options are very different and are totally dependent on the etiology or cause of the problem. But first, let's start by explaining how to evaluate patients who present with a complaint of a gummy smile. It is important to look at the smile as a whole and each of the individual aforementioned components individually. However, it is just as important to evaluate the patient in repose, as this can give us an indication as to what the etiology or cause of the gummy smile might be. Arriving at the correct diagnosis is crucial in deciding the best treatment options. At rest, with the teeth in occlusion, the lips should be closed or just touching, and the mouth aperture should be horizontal, indicating a normal lip configuration and length. The total lip length is measured in the midline from the point just under the nose, called the subnasale, to the lowest portion on the pink mucosal component of the lip. A normal total upper lip length is considered to be anywhere from 17 to 20 millimeters in women and 20 to 26 millimeters in men. Total lip length includes both the skin and the mucosal component of the lip. When the mouth aperture has an inverted U-shaped configuration, it can be indicative of a short upper lip, which is one of the potential causes of a gummy smile. For these patients who usually present with a total upper lip length of less than 15 millimeters, fillers, grafting, or a lip lengthening procedure might be indicated. The choice of which treatment option is best depends on which component of the upper lip is short, be it the skin component, the pink mucosal component, or a combination of both. Another important aspect of the evaluation is the relationship of the teeth and the lips. When the lips are slightly parted with the upper lip relaxed, the maxillary teeth should extend beyond the inferior border of the upper lip approximately 1 to 2 millimeters in men and 2 to 4 millimeters in women. At full smile, as previously mentioned, if the height of the teeth is normal and the gingiva is healthy, the upper lip should elevate to the level where the crown of the teeth meets the gum tissue, or at most, where 2 millimeters of gingival tissue shows above the teeth. With those parameters in mind, let's discuss how we can use tooth show at rest and gingival show at full smile to differentiate between two of the most common causes of the gummy smile, those being vertical maxillary excess and the hyperdynamic upper lip. Vertical maxillary excess, otherwise known by the acronym VME, is a condition where the maxilla or upper jaw is longer than it should be in a vertical dimension, thereby resulting in the upper teeth being positioned lower than normal in the facial skeleton. These patients, who usually have normal upper lip length, in repose have an excessive tooth show as the teeth are positioned lower in the face. At times, the skeletal configuration prevents the lips from coming together or touching at mouth closure, a condition called lip incompetence. Due to the elongated maxilla, these patients at full smile will also show more gum tissue than the maximum 1 to 2 millimeters considered normal or ideal. The optimal correction for the gummy smile due to vertical maxillary excess is orthognathics or jaw surgery. An orthognathic procedure called a Lefort 1 osteotomy allows for the maxilla to be repositioned higher in the facial skeleton, thereby leading to normal tooth show and gingival show in repose and during full smile, respectively. In these patients, non-surgical options help somewhat, but are not curative, as the etiology of the gummy smile is a structural problem with the facial skeleton. Thus, correcting the structural problem surgically permanently corrects the gummy smile issue. In contrast, patients who present with a hyperdynamic upper lip have normal tooth show at rest as the maxillary teeth are properly positioned, but exhibit excessive gingival show at full smile. The gummy smile in these patients is due to an overactivity of the muscle that encircles the lips, called the orbicularis oris, as well as other associated muscles that function to raise the upper lip. In these patients, the tooth show at rest is normal, but upon full smile, the lip rises higher than the normal, leading to an excessive gingival show and thus the gummy smile. In these patients, impaction of the maxilla is never indicated, as it leads to an abnormally high tooth position, thus collapsing the lip support that comes from the maxillary teeth, thereby making the lips appear sunken and the face appear older. In patients diagnosed with a hyperdynamic upper lip, the correction of the gummy smile is much simpler than in VME cases and usually involves injecting a neuromodulator, such as Botox or Dysport, to the muscles involved. This treatment weakens these muscles so that the lip is not raised as much during full smile. The initial treatment dose is usually between 10 to 20 units of Botox and increased as needed until the desired effect is achieved. The downside of this particular treatment option is that the effects of the neuromodulator are temporary and subsequent injections are necessary every 4 to 6 months. A surgical option for these patients involves tethering the upper lip so as to limit its range of motion. This is accomplished by removing some of the oral mucosa and underlying muscles in the fold between the maxilla and the upper lip, called the vestibule, and tethering the upper lip by suturing the two mucosal edges together. This procedure, however, sometimes leads to less than optimal results, as this tethering of the upper lip can lead to an unnatural smile pattern. This procedure also can have a higher rate than normal of relapse, as the mucosa and the muscle tissue tends to stretch over time. The following table summarizes how 3 clinical indicators evaluated during repose and full smile allows us to differentiate between the different etiologies that manifest as a gummy smile. The clinical parameters evaluated are lip length at rest, tooth show at rest, and gingival show at full smile, which by definition will be increased in all 3 cases. As the first row shows, in cases of a short upper lip, the total lip length will be less than 15 millimeters, and thus there will be increased tooth show at rest and increased gingival show at full smile. For the other 2 potential diagnoses, the lip length will be normal, although in cases of vertical maxillary excess, the tooth show at rest will be increased as well as the gingival show at full smile. This is because the maxilla is positioned inferiorly in the facial skeleton. By contrast, Patients who present with a hyperdynamic upper lip will show normal lip length and normal tooth show at rest, but increased gingival show at full smile as a result of the muscular hyperactivity. For patients who present with concerns regarding their gummy smile, it is important to know that there are indeed treatment options to correct or ameliorate the situation. The best treatment option for a particular patient is dictated by the etiology of the condition and might include surgical or non-surgical options. Thank you very much for your time and attention. This is Dr. Joe Garri. I'll see you in the next episode of the Surgeon's Corner podcast.